If you are someone grappling with truly complex endometriosis, this article is tailor-made just for you. If you have only got a mild case, the odd little cyst, a bit of discomfort during a period, or your problems have been tamed by hormone pills like Dienogest or Elagolix, well, this is not quite your cup of tea. This detailed 7-chapter article is for those who have tried every treatment under the sun, had 1 or 2 surgeries with no luck, or perhaps even had to abandon an operation halfway through. Now, you are at the stage where only a complete surgery will do the trick. Whether in England or back in Kolkata, I have often had to dive headfirst into these mega surgeries for complex endometriosis. The pain these patients endure before surgery is truly hard to watch. Many have told me I have learned so much by just chatting with you. I've never really understood it all before. To be honest, I did not realize how many people around the world wanted to know more about this. So, at their request, here is today's article to boost awareness and, most importantly, to help you take the right steps if endometriosis is making your life miserable. Let's help you get closer to feeling like yourself again, one step at a time. Call endometriosis a nuisance is putting it mildly. It can be downright miserable. It often strikes younger women, many of whom are desperately searching for relief. For most, a bit of medicine or minor surgery is just the trick. But for some unlucky souls, even when everyone else has thrown in the towel, the suffering just drags on. Work, house chores, and even simple holiday can feel like climbing Everest in flip-flops. Now, you might wonder why a gynecological cancer surgeon like me is banging on about endometriosis. Simple. While it is not cancer, endometriosis can sometimes cause so much havoc that it behaves like one, invading nearly all organs and causing utter chaos. That's why these cases need big guns, specialist surgeons who are not easily phased. Endometriosis brings a bizarre array of symptoms. Honestly, the list is endless. There is the unusual pain and bleeding, but some get kidney trouble from urine backing up, and it can quietly damage the kidneys without showing up on standard tests. Others suffer from constipation so bad it comes with mucus, or lose their appetite, or need pain injections just to get by. Science can't always predict who will get what, but when symptoms hit, they don't mess about. After years of misery, patients dream of better quality of life, recovering from surgery, breathing easy, and maybe even taking a trip to Goa or Japan. But booking a surgery is not as easy as booking a flight. Endometriosis clings to multiple organs and simply refuses to let go. The strategy for these operations is a whole different ballgame. Surgeons spend days planning and preparing, then hours in theatre with nerves of steel. Not every hospital has the right setup, and even when they do, not everyone is up to that level of detail. Chapter 1. Before the surgery. There are 3 key steps you need to tick off. 1. First, pre-operative assessment. First things first, a thorough checkup. Well, we will go through your history, examine you, and do all the necessary scans. The scan images get more attention than a detective at a crime scene. Hours are spent poring over them. The aim? To figure out exactly what sort of surgery will help you the most. We map out every spot of endometriosis in your tummy. And no, a simple ultrasound or CT scan just don't cut here. You will need a special MRI. The surgeon and radiologist will have plenty of chats to make sure you get the best care possible. Preparation is half the battle. So, you will also get ready with tweaks on your diet, breathing exercises, and sometimes a few injections of medicines. Expect some deep discussions with you and your family as well. If you would like to get your hands on the PDF of this preparation before surgery, just fill out the form at the link below. The file will land in your inbox before you can make a cup of tea. If you don't see it within 10 minutes, do check your spam folder. Sometimes emails like to play hide and seek. Next, multidisciplinary input. It's not just about complex gynecological surgery anymore. Times have changed. Our team includes urologists, colorectal surgeons, critical care specialists, and sometimes even a vascular surgeon. Add to that a physiotherapist, pain specialist, and of course, expert anesthetist will keep you comfortable throughout this ultra major surgery. Endometriosis can be a wild beast, so our team is ready to match it tooth and claw. Next, fertility planning before surgery. Many people haven't completed their families yet, so it's wise to chat with a fertility specialist beforehand. You will want to know if there are any novel treatments that could help you. We'll check if there is a way to save your ovaries or uterus during surgery, and if that is not possible, there is always the option of stimulating your ovaries or storing eggs in the lab for future use. Chapter 2. Surgical planning. Even when surgery is tricky, both patients and doctors usually hope it can be done with laparoscopy or robotics. Why? Because you will bounce back much quicker than with open surgery. But you will need some fancy cameras and special equipments for this. No surgery is a one-man show. Skilled assistants are essential, sometimes more than one. In fact, there is a rather amusing articles about importance of surgical assistants linked below if you fancy a read. There are, however, two situations where laparoscopy or robotics just won't cut it, and open surgery is needed. First, if the endometriosis is so severe or the tumor is so large that there is simply no room to get the camera in. Second, with keyhole or robotic surgery, only instruments go inside. So sometimes the surgeon has to rely on eyesight alone to judge how much tissue is to be removed, which is not always ideal. In some cases, a surgeon's sense of touch, what we call it, a tactile sensation, is vital. Modern laparoscopy and robotic surgery have not quite cracked that yet. Research is ongoing, but we are still a good 2 or 3 decades away from robots with a surgeon's magic touch. So, when that sense is needed, open surgery is the way to go. Don't worry though, patients are not left in agony. Most are up and walking by the very next day, even after complex open surgery. Chapter 3. Removing the affected endometriosis. Back in the day, surgeons would often try to zap the affected endometriosis bits with chemicals or diathermy, that means short electric bursts. Not quite a bonfire, but you can get the idea. It was a recognized method. These days, though, we much prefer to cut out the affected tissues entirely. Why? Because it gives you a better chance of staying well for longer and lowers the risk of endometriosis making an unwelcome comeback. Of course, it is not as simple as just snipping things out. Sometimes the trouble spots are wrapped around important plumbing areas like ureters, those little tubes carrying urine from your kidneys to your bladder. The disease can squeeze them tight, so those areas need special attention too. Deep infiltrating endometriosis, or DIE, can also invade the uterus, ovaries, rectum, even the sigmoid colon. So we often need to be ready for a bit of urinary or bowel surgery as well. Proper planning is essential. That is why when we tackle endometriosis surgery, we put our cancer surgery skills to good use. The approach is quite similar, clearing out those diseases thoroughly and safely. Thanks to advances in science, we can now offer patients those benefits and help them get back to living their best lives. Chapter 4. Organ preservation and reconstruction. With complex endometriosis, it's not just gynecological organs that get caught in the crossfire. Your bladder, bowel, kidneys, and ureters can all be affected too. Protecting these vital organs while removing the endometriosis isn't exactly a walk in the park. Standard gynecological surgery techniques are not up to the job. Sometimes we need to take a clever detour outside the thin lining of the abdomen or peritoneum, what we call an extraperitoneal approach. Not to brag, but these surgeries can last 4 to 8 hours. Traditionally, only cancer surgeons tackle those marathon operations. But when it comes to tricky endometriosis, those cancer surgery skills really come in handy. They help us save your important organs and still clear out the disease. Even if we need to operate on the urinary or bowel systems, we aim to restore everything as neatly as possible so you can enjoy a much better quality of life. This is where All the pre-surgery planning and teamwork between different specialists truly pay off. When everyone working hand in hand, you get the best shot as a smoother recovery and healthier, happier you. Chapter 5. Decision during surgery. Within the first half hour of the complex surgery, the surgeon has to make over 100 of irreversible decisions. No pressure, right? That's why preparation is the key. In places where these surgeries are routine, planning starts right in the clinic. Once you are asleep in the operating theater, these decisions become even more critical, and they can only be made on the spot while you are blissfully unaware and counting sheep. That's why we have plenty of in-depth chats with you before the surgery. We spent hours going over your wishes, worries, and what ifs. So we know exactly what matters to you. We also explain where things might get tricky. So when it's time to decide on the table, we are ready to act at your best interest. To help you on these big decisions, we use high-tech wizardry, 3D navigation system, augmented reality, and a minute analysis of your MRI and CT scan. A handful of old-school film negatives just won't cut it for this level of planning. What we really need is a DICOM image CD or USB drive packed with thousands of your images. This lets whole surgical team meet, review, and plan your operation together so you get the best possible outcome. Chapter 6. Post-operative care. After such a complex operation, we pull out all the stops to keep you pain-free. Our expert anesthetists start modern pain relief even before the surgery begins, so you are comfy from the get-go. No one feels a thing during surgery, but keeping pain under control for the next 2 to 3 days is a real medical art. Luckily, it's one we have mastered. Our nurses are trained in all sorts of clever techniques to make sure you stay as comfortable as possible. Nurses are always standby to keep pain medications on demand, so you are never left waiting. Monitoring is crucial too. Regular blood tests help us spot any sneaky infection early, as these big surgeries can sometimes invite unwanted guests. That's why we use second or third generation antibiotics to keep things in check. A smooth recovery actually starts before your operation. We'll teach you what to eat, how to do breathing exercises, and even how to walk after surgery. During the op, you will be wrapped in a warm air blanket and special socks that gently pump your legs, all designed to get you back on your feet and home as soon as possible. Chapter 7. Getting back to life and sex. Getting back to your old stuff after surgery is what we call post-surgery rehabilitation. We guide you step by step through physical rehab because, let's be honest, awareness about this in India is still a bit of thin on the ground. But don't worry, it's absolutely possible. Our written guides, videos, and hours of counseling with nurses all help you find your feet again. The physiotherapist will show you how to do your exercises and gradually look after your lower tummy. From pelvic floor exercise to aerobics and power yoga, a couple of months later, we'll walk you through it. Many people feel a bit anxious before and after this kind of operation, so we pay close attention to your mental well-being too. We want you to bounce back physically and emotionally. A common question is, can I have sex after surgery? The good news is, after a few weeks of healing, there is usually no reason why not. If you have any concerns or questions, your doctor is always there to help. The boosted quality of life after ultra-complex endometriosis surgery is often beyond what patients ever imagined. Because it is so complex, careful planning and teamwork are essential. It is important to remember, this is not a quick in and out job. Patients, families, and even doctors and nurses need a special mindset and training to make sure you get the full benefit from surgery. When everyone else has given up hope, these advanced surgeries can offer a brand new start. So, keep your chin up. There is always a new dawn. If you want to learn more about endometriosis and its treatment, check out our endometriosis masterclass link below. That's all today. See you soon with another video research article. If you have got any more questions, just write in the comments. We'll try to answer them.